Amish, we're going to do, and I know you've had a sleepless moment, but you and I are going to do the math. Myocarditis off second shot, the number I'm working with needs scientific notation, 1.46 times 10 to the minus 3. Okay, fine. The percentage numbers here, does the public understand how small the likelihood is of a frightening myocarditis off the second dose?
It's unclear. I do think that sometimes when we talk with numbers like that, the general public, it goes over their head or they don't really concretize it, because what they think about is they heard some anecdote from somebody who had a kid that had myocarditis, and to them that's 100%. So sometimes it's very hard to teach people how to risk calculate because they're not able to, and they're very swayed by anecdote.
John,
so what we really do is show them how rare it is.
I mean, John, this is critical, and this has to do with social media. I'm sorry, social media doesn't do the math.
Well, Tom, even when I hear from health officials, though, directly, I'm still confused as to what I need to do. Amish, let's talk about that now, Doctor. I was fully vaccinated in and around sometime in May, let's say, and I'm trying to work out how protected I still am from this virus. Do we have any idea? Does it vary from person to person? Do these vaccines only last 6 months? Doctor, what are we learning about that?
Well, it does vary from person to person, but you have to take a step back and ask, what do you want the vaccine to protect you from? Do you want it to protect you from serious disease, hospitalization, and death? Or do you want it to protect you from every breakthrough infection, even if it's mild and doesn't even require a doctor's visit? When it comes to the former, serious disease, hospitalization, and death, unless you are above the age of 65, immunocompromised, have some high-risk condition, your vaccine is working really, really well for you. For breakthrough infections, I don't think that these first-generation vaccines should be used to kind of chase breakthrough infections and kind of kick them down the road, because we don't know how durable that response is, and we might be doing this again in another 6 months. So I don't think that's a good use of the boosters. But for those above the age of 65, those with high-risk conditions, and those who got the J&J vaccine, those individuals should get an additional dose.
Dr. Adalja, the implication here is significant that you don't think that it is worth trying to prevent breakthrough infections for people who are vaccinated who do not have pre-existing health conditions. Is that what you're saying, even though those people could potentially transmit the virus in a social setting? This is not something that should even be tracked if they're not going to get hospitalized, if they're not going to die from it?
It's unclear how well it actually prevents against breakthrough infection. We have some limited data that shows, yes, for some period of time after that vaccination, you may be less likely to get a breakthrough. However, we don't know how durable that is. And other individuals, including Paul Offit, who's on the FDA committee, said this is like akin to kind of rolling a boulder up a hill and only have it to roll back down again. So I don't think that's the best strategy, because the virus isn't going anywhere. Everybody is going to get COVID-19. Hopefully it's a breakthrough infection and not and mild for them. And I think that's what we have to do with these first generation vaccines. There may be vaccines down the line that induce more immunity in your nose, which may be more beneficial for preventing breakthrough infections. But I don't think that these vaccines are really going to be good for chasing breakthroughs in mild people. And we don't actually know how contagious these individuals are. And clearly, if you've got symptoms, you should be tested and you should isolate and not expose yourself to others. But I don't think that this is something that's driving cases across the country. This isn't what's causing the problem. The 70-something thousand cases we have every day in the United States now are not being driven by breakthrough infections. They're being driven by unvaccinated individuals.
Dr. Adalja, you've come on this show repeatedly over the past few weeks and frankly even a couple of months and said it is time to transition to a new reality where COVID is just present and we have to live with it. And I wonder how controversial this is, how much pushback you get from colleagues, how heated your conversations are. As so many people, whether it's China looking for a zero COVID policy or even here in the U.S., it still is really trying to adhere to pandemic era policies.
I came out and said that this was going to be the fifth seasonal coronavirus back in February of 2020, and that we had to start thinking about it then. I had a lot of pushback early on, but now I think people are coming to the conclusion that really was something that wasn't even questionable based on the fact that this is a respiratory virus with an animal host that spreads efficiently, that this is going to be endemic. So that pushback is lessening, but there are people that are having a hard time adjusting to a new world where COVID-19 is always going to be there, that there's going to be COVID-19 cases 50 years from now. And I think that's because because people weren't told that ahead of time. And public health really went on this abstinence-only approach where never do this, don't do this, this is always going to be risky, and didn't teach people how to risk calculate to adjust their lives or recalibrate their lives with the fact that COVID-19 is going to be a respiratory virus that we deal with year in and year out. And you've got to learn how to cope with it. You've got to learn how to make good choices. And the best way to do that is to be vaccinated so COVID-19 is not a problem for you.
Doctor, do you think, you mentioned public health policy, and I'd like to finish here with you. Do you think there has been a risk, particularly over the last year, that a lot of public health officials now are conflating the science with what they'd like to see in social science, behavioral psychology? Do you think that's where there's some confusion at the moment?
I definitely think that people sort of took their values, whatever they might have been, and kind of applied them to COVID-19 policy. And that's, I think, what caused all the acrimony over masks, over vaccines, people protesting. All of that really has to do with the way society kind of viewed COVID-19 and how they viewed it through the lens of whatever tribe they were in. And that was how they viewed it, not looking at the science, but what did their tribe think, whether that was the tribe on the right or the tribe on the left. And nobody was actually saying, what's the actual data show here? How can we do this safely? We all have to kind of live with this virus. What's the best way to do it? But I think we live in an increasingly tribal society, and people kind of want to know what their collective thinks, and then that's what they think, and then it becomes difficult for anybody trying to actually break through those bubbles.
We expect politicians in Washington to be politicians. Doctor, was this a failure of institutions, groups like the CDC?
I do think that when you look at what happened with COVID-19, this is a failure of government at the federal level, the state level, the local level, even the school district level. And I do think that the CDC had a lot of failures. You can't really blame them because they've been captive to politicians. They were captive to the Trump administration, where we saw lots of political meddling going on, where the CDC director was basically bound and gagged and put into a trunk. And the same thing, I think, is happening to a lesser degree, but still happening during the Biden administration, where we're always wondering, did the CDC director overrule that advisory group because she herself believed the science was a certain way against what her advisory committee said, or did she try to make Biden's promise to give boosters to everybody whole? So those are questions that we have, and I do think the CDC is something that's been damaged by this pandemic.